If there's one constant thing about 21st century living, it's the way that things constantly change and adapt. What were once busy industrial areas have become redundant, unfriendly and inaccessible places, full of dereliction and decay. Facilities that were once cutting edge, over time have become tired and inefficient, and are now reaching the end of their useful life as new ideas, practices and technologies come along. But what some may see as relics of an industrial history, an obsolete system and a soon-to-be-forgotten past, others with vision see as a substantial and unique opportunity. An opportunity to make a fresh start. To provide new, purpose-designed and integrated facilities, allowing the delivery of new techniques and a new approach. To start afresh and build a better and more sustainable future. The Watford Health Campus is a striking and ambitious plan to upgrade the 65 acres of land where the current hospital, the Cardiff Road Industrial Estate and the football stadium now stand. The vision is to transform this part of West Watford through a unique partnership to deliver improved health, a more sustainable community, better transport links and enhanced leisure opportunities for West Hertfordshire.
It's a once-in-a-lifetime opportunity to regenerate a blighted part of Watford and to make something that now is something that we're ashamed of into something to be immensely proud of and of great value to the whole community.
The development also creates new riverside cycleways and footpaths through the site and provides a new lakeside park, delivering more green open space than existed before the development. This is achieved by turning the currently unavailable industrial land into publicly accessible open parkland. At the moment, much of the 65 acres of land is poorly used, but through careful design this can be transformed into a quality environment in which to live, work and play. But it's a complex regeneration project which could take up to 10 years to deliver in full. CABE, the Commission for Architecture and the Built Environment, said of the project,
"We applaud the key stakeholders for their aspiration. The master plan is realistic, robust and well considered, and has come together in a way that offers more than just a resolution of constraints. We're delighted to see that a hospital is being treated as part of a town, and believe that success lies with the intelligent, integrated approach to the project."
The Watford Health Campus is promoted by three main landowners: the East of England Development Agency, Watford Borough Council and the West Hertfordshire Hospitals NHS Trust. There's an additional 5 organisations who have a stake in the project: the East of England Strategic Health Authority, Hertfordshire County Council, Hertfordshire Partnerships NHS Foundation Trust, West Hertfordshire Primary Care Trust and Watford Football Club in partnership with Origin Group. Between them, they're working towards an overall investment of about £1 billion over the 10 years. So what will West Watford get for this level of investment? Well, the key is in the name Watford Health Campus. Central to the whole project is a new hospital of around 600 beds, costing between £250 and £300 million, which will provide the specialist, complex, high-risk and high-tech end of the spectrum of hospital care for the whole of West Hertfordshire.
Yeah, the acute admissions unit, which will be opening shortly in March 2009, is a crucial first step along the line to a new hospital. It allows us to reconfigure our acute services from 2 sites onto 1, but it's an entirely new model of care where all acutely admitted patients go to 1 ward area, are seen by senior doctors very quickly, therefore get their diagnostics and their treatment much more quickly, and therefore they stay a shorter period of time in hospital. Now that reconfiguration onto 1 site improves the quality of care for our patients, but also makes it financially more viable going forward.
We've never been somewhere where you actually are in bed, you're going to get blood tests, x-rays, if it's heart, catheter lab. It's just all there, everything's there. And the blood test will come back very quickly because everyone is there on site.
And the other iconic building currently on the Health Campus site is the Watford Football Club Stadium. This will also benefit from the redevelopment of the area, with enhanced facilities and the potential to integrate with the proposed hotel and conferencing facility. The club also have plans to expand the stadium by providing a new east stand. While these are formally outside the campus proposals, the football club is keen to work closely with its neighbours to make sure that an integrated series of developments comes about. But the Health Campus vision is more than just a new hospital and a refreshed stadium. It's an opportunity to become a beacon for healthy and environmentally sustainable living.
What it also does, this is a brand new facility. We've got more highly technical nursing, we've got more complex specialities. That in itself is going to be a magnet that's going to attract nurses not only from London, but keep our local nurses as well. We also deliver our generalist nursing. We have our district general hospital. That's crucial that we have both. So in essence, we're going to be meeting the needs of all nurses, and that's going to be fantastic for West Herts.
Because the campus actually provides a significant amount of housing in addition to the hospital, we see that as a huge opportunity as a trust, because not only does it allow us to ensure that the accommodation we have to provide for resident staff is of a high quality, fit for the purpose, attractive for people to live in, but we've also got the opportunity for staff to live amongst a community. But we don't want to create a medical or clinical ghetto, like in the old days where you'd have the old nurses' home and sort of, it just becomes a sort of an extension of the workplace, but something where people can live and work in an environment which is conducive to a really good quality of life and really feel they're part of a local community, and that they work at the hospital but they live within West Watford, and that they're very much part of that wider community.